Hello, everyone, and welcome today. I think all of our folks are coming in from the waiting room. So I'll pause here for a second as folks are coming through cyberspace and joining us on our second webinar of our 4-part series, where we are doing trainings on strengthening advocacy around Medicaid expansion for people with disabilities and dental care access. So thank you everyone for being with us here today. Again, as I said, this is our second training webinar of a 4-part series. My name is Liz Flannery. I use she, her pronouns. I'm the Director of Education and Leadership at the American Institute of Dental Public Health, or AIDPH. I am a white woman with light brown curly hair, and I am absolutely thrilled to be here with everyone today. We can go ahead and go to the next slide. So what we're going to talk about today, I'm going to give us a welcome, go over some housekeeping pieces, an overview of what we're talking about. Then we're going to go into our presentation on data-driven advocacy and using data for shaping Medicaid dental policies for disability access. We'll follow that up with a case study and then followed by some time for Q&A. And then we'll have a community discussion around what we've heard today for discussing and solution finding. A main point I want to share here today is that we want to hear from all of you. So while we are presenting, please, if a question pops up, you have a question or a comment, please share that in the chat and then be ready to engage in discussion after we move past our presentation portion. It's very important that we hear your feedback and hear your voice. So please feel free to share as we move through this program today. If we could, we want to take a moment before we move into other pieces and thank our funder. CareQuest Institute for Oral Health is funding this program, which is in partnership with, again, American Institute of Dental Public Health with the Coalition of Texans with Disabilities. And we thank CareQuest for funding this project and making it possible so we can build out these resources, share them with you all, and be here in community together today. So thank you, CareQuest. We can go on to the next slide. Some housekeeping pieces I want to share. Closed captions and live transcript have been turned on, but they are not 100% accurate. Live captions currently don't work within breakout rooms, only the main room of Zoom. We will be using breakout rooms later on in the session. If you are invited to a breakout room and you need those closed captions, then please just ignore the invitation and stay in the main room. Closed captions are available on Zoom iPhone and Android phones, but live transcript is not. We are recording our session here today. All of our materials, including the recording that we're developing here today, will be available on the AIDPH website. We are super excited to be here together in community, so please share your name and the organization in the chat. And if you have any questions about Zoom, need technical assistance as we move through our time here today, please pop that into the chat and a staff member from AIDPH or CTD will help you out. We can go on to the next slide. So I want to give a little bit of an overview of AIDPH and the program that we're doing here today. Our mission is to empower our community to advance oral health through science, education, and advocacy. And that's what we're doing here today. We're pulling data together into an education piece on advocacy. And as we're doing that, we're working towards our vision, which is a justice-oriented oral health system. We can go to the next slide. At AIDPH, we have 4 communities of focus as we do that work to achieve a justice-oriented oral health system. These are communities that have been historically excluded, marginalized, or oppressed, particularly when it comes to oral health access. These communities include LGBTQIA+ people, veterans, people with disabilities, and people in rural communities. And of course, we also recognize that there is intersection among those groups as well. We can go to our next slide.
Hey, Liz, I hate
Yes.
to interrupt. We have a couple folks in the chat saying it's a little difficult to hear you. So I wonder if you
Okay.
Thank you.
Thank you. I'm going to move my computer closer, and I'm also going to click my mute on and off. Sometimes that makes me a little louder. So I don't know if that's any better, Grace, if you're getting a quiet on your end.
It's sounding good to me.
Okay.
Hopefully, I think just the more you can be close to your microphone, the better for some of
Okay.
the
Well,
participants.
I hope my face isn't too close for everyone. Thank you for the note, and I will also make sure to project.
Thanks, Liz.
Um, so I want to give an overview of the full program because we're here together today on a training webinar, but I want to make sure that we note that this is actually a multifaceted program that we're doing. So we're doing this 4-part training webinar series, but we're also building out an advocacy toolkit that will have 5 sections and will be digitally available. I'm particularly excited to talk about that part today because we're launching our first section. We're building out those sections of that toolkit and piloting each section so we can share it with you all, the community, and garner feedback on its usability, its helpfulness, then make adjustments and make it available as a full 5-part toolkit. Over the next few months. So part of what we're talking about here today, using data and advocacy, is directly from that part of our toolkit. And we'll be sharing that actual resource as well as a form to provide some feedback on that in just a minute. The third part of this program that we have is a bill bank, which will contain sample legislation for state-based stakeholders to review and replicate in advocacy work, and that will be coming out later this year. And then with our training webinars, we have continuing education credits that are available for all of the sessions that we do if you attend live. And we'll provide information on how to request those CEUs at the end of the session. We can go to the next slide. So again, our training webinar series is a 4-part series. In March, we talked about a community-led approach, and that recording can be found on our website. Today, we're talking about using data in shaping policy. In July, we'll be talking about non-traditional partnerships and creating legislative champions. And in September, we'll be talking about implementing policy after the legislation has passed. So once you get to that change, then what? What are your next steps? And we'll have registration information for our upcoming sessions at the end of the session as well. So we hope you keep track of those and join us throughout. We can go to the next part. And then again, I was talking about the toolkit. This is just a little bit more information on what those sections will look like and what you can expect throughout the year from this program. So today we're launching our using data for policy section. Again, we'll share that with you. We'll ask for your thoughts and feedback, and that's really informing the content that we're going over here today. But the other pieces that we'll be launching will be a section on understanding political landscapes, a section on engaging with decision makers, a section on building non-traditional partnerships, and a section on frameworks for storytelling. And the slide here we have outlines that with just a graphic on the side of what that will look like. We can go to the next slide. Our session facilitators here today, we have a photo of all of us. To the far left, we have Chase Bearden from CTD, who will be sharing a case study. We have Laura Perner from CTD, who will be leading us through our community discussion. And myself, again, Elizabeth Flannery from AIDPH, all the way to the right. I will be presenting on using data to shape policy. So we can go to the next slide. These are our learning objectives. Again, we will have CEU available at the end of this session. And these say that by the end of the session, participants will be able to analyze the role of data-driven approaches in formulating and reforming Medicaid dental policies for adults with disabilities. We'll be able to demonstrate the ability to source and interpret relevant data to support advocacy for expanded Medicaid dental benefits. And we'll be able to construct compelling arguments using data to showcase the necessity and impact of policy changes in dental care for individuals with disabilities. And we're popping those in the chat as well. We can go to the next slide. This slide is our disclosure slide, and our presenters do not have any disclosures to share today. We can go to the next slide. So using data for policy change. Without further ado, we will get into the main part of our presentation. The slide that we're looking at right now is a map of the United States. And there are 11 states here that are highlighted in a dark blue. Those states that are highlighted report covering one or more services for adults with intellectual or developmental disabilities that are generally not provided to other adult beneficiaries. And the states that are not highlighted in that dark blue color do not report covering those services. So what does that mean? What is kind of that status that we're looking at? Currently, 11 states offer dental coverage for adults with intellectual and developmental disabilities. However, that coverage is very often inconsistently applied among disability groups. For example, adults with physical disabilities, and gaps can occur. And this is really just a level setting of why we're talking about this today, why this advocacy needs to happen, and what change we need to move forward so greater access to dental care is available. We can go to the next slide. So we've said data a lot already on this call, and we'll be talking about data impacting policy throughout this session. And I want to take a note here and talk about community engaged research and how we get that data that we're talking about. There's a graphic here today that shows the approach that American Institute of Dental Public Health takes to research, and that's a community engaged approach. And there's a circle in the middle with arrows that represent kind of the intersecting steps of how it's a cyclical process of conducting research and engaging with the community. Over to the left, we have American Institute of Dental Public Health. And as an organization, we have knowledge, expertise, technical skill, research capacity. And over to the right, we have community research partners. And our communities have the lived experience, the community trust, the representation, and the direct benefit of the research. And in the middle, we have a graphic representing how we can really interact together by sharing strategies, working together, ensuring the community owns the data, working together on publication development, and then working to implement that data in the community. So just a note here that this is really at the foundation of how we approach our work. And when we're talking about data and research, we really encourage the community engaged approach. We can go to the next slide. So when we're talking about using data to shape policy, there are some challenges that occur. So the first part of our toolkit, kind of after our background, we look at some of those challenges and share solutions of how we can approach them. So I just want to kind of go through that piece at the beginning. So right off the bat, when we're looking to use policy in our advocacy approaches, identifying what the important data is can be really difficult. There's a lot of potential data out there, and pinpointing the most relevant data for policy advocacy can often feel very overwhelming. And when we want to know what's the essential data, we want to look for what's showing the needs, the barriers, the potential outcomes for expanded dental benefits for adults with disabilities. So what are some strategies we can use for identifying the important data? Focusing on data that specifically relates to oral health and broader health outcomes from oral health care. Data that looks at accessing barriers to access and economic implications of dental care and Medicaid is very important. Again, engaging with community members and stakeholders to determine the most pressing data needs and questions is incredibly important. And the next challenge we can face is accessing that relevant data. So identifying and accessing the right data sets can be, again, overwhelming or daunting. Data on Medicaid dental benefits and usage by adults with disabilities is disparate. It comes from various sources, including state Medicaid programs, healthcare providers, and research institutions. So understanding where to start can be tricky. So what are some strategies we can use for accessing the relevant data? Building partnerships with Medicaid agencies, academic institutions, and nonprofits focused on disability rights to access that shared data is key. Utilizing the Freedom of Information Act, or FOIA, requests as necessary to obtain those public records on Medicaid dental services. And partnering with legislators to request data that can be difficult or time consuming to access. So legislators sometimes have different sway, different pull, different access, and partnering with them to understand the need can really help us get to some of those pieces. We can go to the next slide. Another challenge that we can face is the completeness and the quality of data. So often we have some high level data that is lacking a granularity that's needed to accurately reflect the experiences of adults with disabilities in Medicaid. And that can lead to an incomplete understanding of their oral health needs and the barriers that they're facing. This is, again, a piece where that community engagement piece can really come into play. So what are some strategies for addressing that challenge? As public health professionals and advocates, we can advocate for the inclusion of oral health metrics in existing disability and health surveys. And we can collaborate with researchers to conduct targeted studies to fill those data gaps that we're seeing in the community, especially those looking at the intersection of disability, Medicaid, and oral health. Another challenge is using data for policy and advocacy. So once we have this data, we've identified it, we've been able to access it, then translating that raw data into compelling arguments for policy change really requires a deep understanding of policymaking process, of data analysis, and navigating that technical, political, social considerations to make the case can be tricky. So some strategies that we can use are developing narratives that connect data points to real people's stories. This is something that we work to do at AIDPH, and we've done with our veteran oral health advocacy days of partnering folks from the community, veterans, with oral health experts so they can share the data with the real world lived experience, and it makes an incredibly compelling argument when you have that opportunity to get in front of a legislator. And using data visualization tools. Also another strategy we use at AIDPH of trying to pull our reports into very visually appealing, easy to understand data representations. Okay, we can go to the next slide. Okay, so translating that data into policy solutions. Strategies there include partnering with policy experts and economists. This is a piece that might sound a little daunting, but really leveraging your community and understanding what expertise folks have and if they're willing to volunteer their time, and really kind of understanding who's in your community and put that need out there is a good way to partner with folks who might have that expertise. Understanding and sharing successful models from other states. This is a great call out to everyone here. If you are a state who has found success or knows a state that has success, that's a part that can be really useful and is an opportunity to share here. So we have in our evaluation an opportunity for folks to share resources, and we're hoping to pull all that together. So as we're coming together using these toolkits, participating in these webinars together, we can kind of share those success stories and learn from each other. So please shout out or share in the discussion if you have a success story to share. Another challenge that we can face is engaging with diverse stakeholders. So when we're approaching advocacy, there are a lot of folks we have to work with, and a lot of folks with varying opinions and interest pieces of how they might interpret the data that we're using. So convincing policymakers, healthcare providers, and the public of the need for policy change can be challenging, and really taking the time to understand where they're coming from and what they're looking for. Okay, I will try to keep projecting. Thank you, Jan. Understanding the folks that we're speaking to and their needs and their perspectives can really help us as we're translating that data and moving it into targeting messaging. Another piece is to organize community voice with forums and workshops, and that's really, it takes a lot of time, but that community engagement piece of bringing folks together, hearing what people need, looking at the data together and shaping that narrative to share out in your advocacy work really puts together a very strong, cohesive narrative and is really worth the time. And the last challenge that we want to talk about is evaluating impact. So once policies are implemented, evaluating their impact is very important, because Policies don't always stay the same, and we want to understand what they're doing and understand that these new policies are valuable in the impact that we're having. So we need to develop effective monitoring and evaluation frameworks, and some strategies we can implement there is advocating, again, for inclusion of robust evaluation measures and policy proposals, ensuring that data collection is an integral part of policy implementation. So as a public health professional myself, and as I'm sure a lot of you know on this call, that evaluation piece really needs to start at conception versus kind of down the road once something has already happened. So while it might seem like a later date piece, evaluation and conversations around how that will happen right from the get-go is very important. Partnering with academic institutions to conduct longitudinal studies assessing the effects of policy changing can be a really great way to kind of have that implemented from the get-go. And providing training and capacity building initiatives for healthcare professionals and researchers who are the ones actually conducting evaluations in the context of disabilities to ensure that accurate and reliable data collection is happening. Again, that's kind of where that community engaged research piece happens, understanding what that context in the frame is, and then going out and educating the folks who are pulling that and conducting that research can really improve the quality of our research, as well as the impact collecting research has on our community. And finally, implementing a system of continuous improvement. So that's going back to, we're doing the evaluation and then making sure we're looking at what we're finding and adjusting policies or approaches as needed based on what we see from those evaluations. We can go to the next slide. So the next section of the toolkit we have is using data and research to make the case. And this is a piece I'm actually not going to go into too much today, but I just wanted to highlight that this does exist within the toolkits and let you all know it's there and you can really dive into it. It's fairly granular, but it's kind of looking at the different approaches we can use with data and really dialing down of how to find specific types of data, what variables you want to use, and then what framework you can use for the analysis on that data. So I'm going to share one example here. And again, I'm not going to go, we can go to the next slide and we'll look at an example of what that looks like within the toolkit. So if we want to talk about access and utilization rates, where could we find data that would talk to us about that? We can look at Medicaid claims data, state health department reports, other publicly available surveys such as BRFIS. When we're looking at the data, some of the variables to use are the number of dental visits, the types of dental services received, demographic information, age, disability type, etc. And as we look at that, an analysis framework we can use is looking at trends over time, comparing utilization rates between states with different levels of dental benefits, and looking at the disparities. So again, this is a pretty granular part of the toolkit. So we're not going to go super into it today, but I wanted to highlight that this exists for many pieces that you might want to be approaching in your advocacy within the toolkit. So please take a look, let us know what you think, and know that this is there as a resource as part of the toolkit. So the next part of the toolkit, we can go to the next slide that we'll talk about a little bit more. So we've talked about the importance of using data when we're working in advocacy. We've talked about some of the challenges that can make it feel overwhelming. So now, hopefully that wasn't too discouraging to look at those challenges. The hope there is that we have strategies and pieces that can make it less discouraging. So the other part of the toolkit we have is just a quick getting started guide, a checklist for using data and policy. And again, this is hoping that if it's feeling overwhelming or you haven't done this before, you're not sure where to start, this is a really quick space where you can go and see what you can do to get started. So the first piece is defining the policy goal. So here is really kind of just coming together with your organization, your community, and clearly articulating your specific policy change or advocacy goal, what you're trying to do. Identifying how this policy change will address the needs of adults with disabilities in relation to Medicaid dental benefits is a really important piece to articulate. So that's a great place to get started. It's level setting. You know where you are and you know where you need to go, and it's easier to kind of fill in the steps of how to get there. The next getting started step is identifying the stakeholders. So we talked about that as there's a wide range of stakeholders when we're approaching advocacy. So again, just doing an initial brainstorm, doing a full list of who the stakeholders are, to include community members, advocacy groups, policymakers, healthcare providers, and researchers. Again, this is really kind of doing a high-level situation analysis of knowing where you're starting, so then you can know who to approach and where to go with those pieces. Once you've made that list, determining the role and interest of each stakeholder in the policy change process will also help you develop out how to approach them. That piece that we talked about of understanding where they're and what's relevant to them really plays into this piece. And then planning to engage with those stakeholders through meetings, forums, or surveys to gather input and support. Again, back to that piece where pulling your stakeholders together and forming a strong narrative through workshops, forums, town hall meetings, really gathering everyone together. The next step would be assessing available resources. So a situational analysis. So if you're an individual or you're an organization, anyone can do this. It might look a little different depending on how you're approaching this, but taking time to evaluate internal resources that are available for the project. So again, if you're an individual or grassroots organization, that might look a lot different if you're a larger nonprofit or other type of organization that has more resources. So part of that might also be identifying external resources needed, such as those data sources we've talked about, partnerships or funding opportunities, and then developing a plan for securing additional resources if necessary. Our fourth step is engaging with data experts. So collaborating with data analysts, statisticians, or researchers who can assist in data collection and analysis, and considering partnerships with academic institutions. So something I was going to say there of data analysis, that might be if research is outside of your purview, it might not be obvious of how we find those data analysis. I think one, making a call out to your community and letting folks know that this is something you're approaching is always important, because you never know who in your community might have those skills. And then again, looking to those more formal institutions, a nonprofit who does conduct research, an academic institution who might be looking to do a research project. This step 5 is gather and analyze the data. So again, going back to that piece of identifying what data is needed to support the policy goal, if you have that clearly articulated at the start, you can understand what you need and how that connects. Determining sources for the required data, including public databases, research studies, and community surveys. You can understand what is already there and what you need to, what data gaps might need to be filled, which can also, again, inform who to partner with. Outlining a plan for data collection, including methodologies and toolkits. And then analyzing data to identify trends, disparities, and key findings relevant to the policy goal. And then our final step in our quick start getting started guide is evaluating and adapt. So again, evaluating really needs to start from the beginning and be involved through all of the pieces. So how we get started with that is establishing metrics for measurement. What do we need to measure and how are we going to measure it? Making a plan for regular review. So you know what you're going to measure, you know how you're going to measure, and then making an internal plan for checking in with that, and also making an internal plan for adjusting your program if needed, based on what you're finding with those metrics. You can go to the next slide. So we have that checklist. We also have a try this first. Again, just to make things a little more accessible and a little less intimidating. This is a try this first, how to get started. What are you looking at? So again, leveraging existing data sources. If we're thinking that we need to conduct longitudinal studies, big study pieces, it can feel really overwhelming and like we might not have something to start. So look at what already exists and start from leveraging that. Conduct targeted mini surveys. Again, that's a piece that's fairly accessible to many folks outside of academic institutions, and there's resources out there how to put together a successful mini survey, and it can give you some added oomph to that existing data that's already there. Looking at policy briefs, position papers, this ties into looking at what other folks are doing, what other states are doing. As I said at the top of the call, part of the program that we're doing here will include a bill bank. So some of those policy briefs, successful bills, verbiage and content for putting together suggested policy will exist. That will be a resource that will be a part of this program that we're talking about today. And hosting webinars and public forums, going to the community and asking what they need, what they've, maybe folks have started and stopped or done some initial research and might have insight into what is available and what is needed, is always a really good place to get started. So this is a general outline of our toolkit. I'm going to go to the next slide, which is the last part of our toolkit. We include a worksheet here for you all to get started. So it gives some initial information on how to use data and the best way to approach it, and then some worksheets so you can really print it out, take notes, get yourself started, and move from information to action. We want to really make sure that the information that we're sharing are helping folks take next steps. So I want to highlight that that's there as well. And Grace, did we post the toolkit in the chat? Is that there?
I will do that right now.
Okay, awesome. So we will post a link to the toolkit. We will also post a link to a form, a feedback form. So again, we would love to hear from all of you. We built this out for the community, and we want to really hear about, is it helpful? Is it usable? What improvements can be made before we finalize it? So we'll share those two resources. We will email them out as well after this session. And I'm going to move to the next slide as we do that. And we are going to hand the mic over to Chase from CTD to talk about a case study of some work CTD did in using policy for data for policy change. Excuse me.
Thanks, Liz. And again, my name is Chase Beard, and I'm the executive director at the Coalition of Texans with Disabilities. And, a part of what we get to do here is really work in the building to try and pass things that we know are right, things that we know are going to help people, kind of like what all of you are on this for. But what we've learned over the years is that it can sometimes be very difficult to get some of this work done. These are complex topics. Depending on what state you're in, it could be that you only have a limited amount of time to meet with the legislature. So you really do have to use every opportunity you have to the best ability. And I think for CTD and for others working in this field, one of the areas that we've really kind of had to start leaning on more and more is data-driven advocacy, especially in these bigger Medicaid-driven health policy areas. And we've really kind of poured a lot of time and money into two different examples that have and I think all of them have taken time. None of these were quick fixes. I think that's always something that should be looked at. If you can make it happen in one session, that is amazing. In Texas, it's not always that easy. So what we do here a lot of times is we run up against a clock with our legislature. Since we only meet every other year for 6 months, they can only vote for 4 of those months. So everything gets compressed. And one of the only things Texas has to pass is our budget. Nothing else matters, really and truly. That is the only thing our Texas Constitution requires of the legislature. Our budget is so enormous And when it comes out, you don't have much time to look at it a lot of times. Most legislators have no idea what's in there. Most staffers don't. It takes a very unique individual to be able to handle that much information. And with that being said, I think you have to be able to make a case for anything that's going to cost money, especially in Medicaid. And using good data and having someone who's done the research who can spell it out for you while you're doing the advocacy part, or you're digging in and helping find those people that have the lived experience and marrying those two things up. That's what makes the difference for the whole thing. You have to be able to paint a very broad picture. For us, you look at it in a sense of our own Health and Human Services Department tends to be in a rush. They are one of the largest agencies in the country, and we don't always get the best data out of them. They may read a bill and then go and fill out the paperwork, submit to the legislature. And for us, having this data that we had and the studies, having an independent economic study that complemented the human side of this, helped us kind of offset the erroneous and refute the bad data coming out of our state health system. You only have so much time to pass that bill, and it's very easy to kill a bill that has to do with anything with money. So we had to all move quickly to be able to get that kind of settled, and making sure that the legislators had the right information to be able to ask our state health services, and making a good pitch to them, one that had the ability for them to have an argument so that they could push back against HHSC, one where we could refute any bad data we saw coming out, and one that could show kind of the not just the economic benefit in the long term. Since Texas doesn't look at our budget in the long term, we only look at it in 2-year cycles. So if we can only prove that it's going to save money in year 4 or 6, it's very difficult sometimes to sell in our state. We'll continue spending money on something instead of fixing it. So you really have to do your research. You have to take that time. You have to make sure ahead of time they know this is going to save money. It's going to create better health outcomes, which then has an expanding kind of ripple effect. When someone has good oral health, all those other things that Medicaid and the state are paying for are greatly reduced. And that's kind of a key thing, looking for those other areas that you can bring in, making sure that when you do this research, I'll be the first one to admit I have a great skill set, and it comes in the Capitol working with legislators, finding opportunities and moving this stuff forward. If I had to do this research, it would not be good. I think that's where it's so important to find your partners. Like Liz said, working with universities, working with any third party that can help you through that process. And then spending that time also including those who are the most effective, those with lived experiences, preparing them and bringing them in to be a part of the whole process, not only the end process. I think sometimes that is left out of how we advocate and how we try and do things. A lot of organizations tend to go straight headfirst into trying to get something done and forget to include from the beginning that lived experience, because it will affect the way you look at things. And when people are included farther into the process, they're more likely to understand it better and be able to assist you better in the advocacy side. So having good data-driven information, reports, that is a part of the whole package of advocacy, especially when you come to look at the big part. I don't know that we would have gotten this moved all the way through without all of the efforts and research that came along with it, along with raising a tenant wages in Texas. We kind of took a similar approach of getting the same kind of economic, research done and being able to prove that a third party is saying it, not just CTD and advocacy organization. There are a lot of staffers in those buildings who have that kind of research background. So if you show up with something that's inaccurate or glaring, they'll throw it aside. So you really do want to make sure that the data you're bringing in isn't something that you just kind of did on the side. You really want to work closely with the groups, kind of like Liz said, to create that plan that expands out. So for us, it was just a very large coalition. And I think everything they did, everything we've done, and we continue to fight for these things. So the best advice I can give you is exactly what Liz was talking about. Find your partners early, work with them, find the research, prove it out, and make sure you have a good storyline that people can go by. And the next thing you know, you'll be able to work through the process. And Liz, if you have any other things to add into that, or else I'll hand it over to Laura to allow people to go into the rooms.
Yeah, that would be great. Thank you so much for sharing. And Laura, if you can take it away on our discussion, that would be wonderful.
Absolutely. Thanks, y'all. Hey, everyone. I'm Laura with the Coalition of Texans with Disabilities. My audio description is I'm a white woman with dark brown hair pulled back behind me. I'm wearing a purple t-shirt. I'm sitting in my room, which is extremely orderly, bed made, nothing on the floor, except for one disheveled shelf over my right shoulder. So we wanted to go into breakouts to kind of give y'all a chance to process this huge amount of information that you've just received on this webinar. So what we wanted to ask is, how is all of this information landing? And we have 3 questions to kind of help you get at that. And they are, what is something you heard in this presentation that's really caught your attention? What is something you've heard that you would like to try in your state? And what do you still have questions about? And we invite you to answer 1, 2, or all of those in breakout groups. Before we jump in, a couple of notes for etiquette. Once you're in your breakout room, feel free to do a sound check to make sure that everyone can be heard and nobody's still on mute. And note that some folks might be using the chat box only, so keep an eye on that. Feel free to give your audio description for folks who may not be using the visual field. If you need help with anything technical or what it is you're supposed to be doing in your room, there's a help button. One of us will be in there to assist or clarify things. And we'll be asking what you talked about in your breakout groups when we come back into the main room. So if you want to have somebody take notes, or if you want to keep your own notes, we'd appreciate that very much. Again, the breakout prompt is, how is today's presentation landing with you? And the 3 suggestions we have for getting at that are, what is something you've heard today that caught your attention? What is something you would like to try in your state? And do you still have any questions? So I think we are set to be in breakouts for about 10 to 12 minutes. And then we'll come back and we'll see y'all then.
Okay, we'll call you back. Enjoy.
Say,
There you
So-
are.
I'm not sitting up properly, but
No judgment.
okay. All right. My name is Trey Brown. Just call me Trey.
Trey.
Yeah.
Hey, I'm Laura.
Nice to meet you.
Nice to meet you.
Trey.
Hi.
And is Sean with us? Maybe.
See.
Oh, just lost Sean.
Okay.
Oh,
Okay.
you, Trey.
Maybe just 3.
So we were supposed to discuss what well, I was shocked to see the map of the US. My state, I'm from New York, but I might be moving to Vermont. And Vermont is underserved, and I'm a pediatric dentist by training, and I'm supposed to take a position there. And it has to do with access for kids in rural areas and so forth. And so
Mm-hmm.
I was shocked to see that New York and Vermont both provide services or coverage, Medicaid coverage, uh, for people with disabilities. I think there were 11 states that did,
11, yeah.
and the rest, wow. And Louisiana also, well, that's where I was born, so I was shocked to see that because the resources there are very limited. Um,
Yeah, I don't know what the story is in Louisiana. Grace, do you?
I do not. I'm in
Okay.
Colorado, and I was the same way, Trey. I was like, oh, Colorado does. So that's really interesting that uh, we weren't aware of our states. And that map when we first I'm communications person for AIDPH, so we did sort of the toolkit formatting. And when I first saw the map, I was like, I'm not sure I'm understanding what I'm seeing here. And hearing this conversation makes me wonder if maybe we can add a little bit more context, about what do we mean, right? Because you're feeling some surprise. So maybe others are too. And that's a piece of feedback you could certainly give us, using that form too. Like I was like, well, I want to know more about that. Like, why are all those other states not the darker blue?
right. Um, Another thing I was thinking during the presentation was, I treat a lot of kids with disabilities and so forth, but I'm in contact with a lot of providers who just aren't comfortable, not just with children with disabilities, but just people in general with disabilities. They don't know how to approach a patient with multiple disabilities. And one of the things they also say is that the reimbursements are so low, it's not worth the time. If they spend an hour trying to get a patient to open their mouth and Medicaid pays them, $10, it's just not feasible. So that's one of the reasons that in addition to not really knowing how to treat the patient, the reimbursement is discouraging to them. It's just not worth it for them to do so. So, and they always say, oh, they're better off seen in an institution or a hospital where there are more resources. And I don't know if you guys have heard that before, but
I definitely those two responses from providers, we have heard that a lot in Texas, and not just with dental, but anything where Medicaid is providing a reimbursement for all types of care. Not having a high enough rate winds up being an access barrier.
yeah,
And
yeah,
it makes sense. Like everyone has to make a living. But also just something that seems a lot more solvable is building in some training on how to interact with patients with disabilities. I mean, I think that that's something that CTD has held those trainings in different settings and tried to facilitate just more of a dialogue between like UT and their medical school, for example, and just community members who have disabilities to come in and just talk to students and be like, look, we're people, like, ask us questions, ask us to
Mhm.
repeat ourselves if you need to. And just be like a first point of contact for how to have a positive interaction. And I feel like formalizing that kind of training, like in medical school and dental school, would be a natural way to address that particular barrier.
yeah, yeah.
And that is something that we hear in Texas a lot. Like, I think that's probably a pretty prevalent attitude. And the idea that people can be better served in an institution or in the hospital is like, I guess what I would say to that, and what I hear from like my friends and colleagues with disabilities is, well, do you want to have to be institutionalized to get your teeth cleaned? Because I don't.
Right,
And I'm
right.
like, yeah, totally.
Right.
So,
Yeah, it's definitely a challenge. Starting with dental students is, yeah, from the ground up, planting the seeds early. Um, a lot of providers just don't know how to approach a patient. They just don't know what to do. just from ground up. And so I think starting early on in the education could help. Um, Most certainly, yeah. Also putting having people themselves with disabilities who are able to present themselves to providers sort of humanizes them and sort of sort of lets the barrier down.
Right.
Yeah,
Right.
yeah. Well, it's interesting.
You know, when you're talking about this, I'm reflecting as well, like this toolkit is specific around like policy advocacy, but advocacy can happen with some of those stakeholder groups like providers and actually consumers. And so I'm noodling on, thinking about how do we show it as more of a complete picture, right? Like there is the policy piece and we're focusing on, kind of legislative pieces, but advocacy, right, can mean broader things too in terms of increasing awareness by, providers that this is a space where they may need, and educators, like training programs. So that's really helpful conversation.
Yeah, I think when when CTD kind of approached just the issue of dental care for people with disabilities in general, it was overwhelming how many barriers there were, from like just offices not being accessible all the way to the more like Medicaid barriers, like reimbursement rates and laws saying like, what Medicaid does and doesn't have to do and what Texas decides it's going to fund and not. And I think that at the same time, like you have to decide, okay, which one am I going to go after and try to change? And of course, we're going a policy angle, but also keep in mind, like the work we're doing is just one part of the whole work to get the people the access to care that they need. And so, yeah, holding both of those in your mind at the same time is still something I'm working on, like successfully doing. But yeah, like opportunities for advocacy at every level, not just legislative. I think that is it's a good point to hit in all of this.
Yeah, and I think the toolkit might touch on that some, Laura. I'm not as in deep with it, but I was just looking at the other sections and there's an engaging with decision makers. So that could be, and then building non-traditional partnerships. So maybe when the whole toolkit comes together, this, you know what I mean? It may connect those dots more broadly.
Yeah, yeah, sure.
Are there any dentists in the Texas legislature? I was wondering, because
There are. I know that there have been, and I know that there are some doctors.
okay.
But I can't think of any offhand that specifically are dentists. And we have quite a few new folks coming in after primaries. So
Change over.
yeah, I don't know if any of them are medical professionals, but maybe.
I've always understood that Texas was quite generous with their coverage and the reimbursements were quite substantial compared to other states. Is that not true?
For dental?
Yeah, for dental coverage.
Well, what we were able to get into statute still hasn't been funded. So, I don't know how the actual rate, once it goes into effect, is going to compare with other states. I'm surprised to hear we're generous, like compared to anyone. But some of our MCOs did have some pilot programs, and I'm wondering if those were maybe where some